Hi guys, welcome to the Black Nurse Guru. I'm Bria, and today I'm going to be doing a video about what is in my clinical bag. So here's my clinical bag, and I usually do carry this bag. If not, I will carry another bag, but all of the items that are in this bag would be in the other bag. So I have this little stethoscope holder case, and I got it off of Amazon. It was really cheap. I really enjoy it. It opens up, and when I do open it up, it just has all of my necessities for my clinicals. Just to let you guys know, I am not in the hospital right now for my clinicals. We're doing virtual because of COVID-19, and that is, I was sad about it, but like I understand exactly why we have to, just to keep everybody safe. So my school did state that we can hopefully join back in the fall, so I'm hoping for that. Okay, so first thing I have in my stethoscope holder is clearly my stethoscope. So I got the Littmann Classic, if you all can see that. It's very good. I got it in like my favorite color, like teal turquoise color. So I have that in there, and I also have my reflex hammer for when I have to utilize it, just to check my patient's reflexes. I also have a pin light. So I got these pin lights off of Amazon. They're really good. They also have the millimeters for the sizes of the pupils. So if you guys want to get these, these are really good. It comes in like packages of 2, so it was really convenient for me, just in case I lose this one. Then I also have scissors. I actually don't use these scissors like so often, but I do have them in here for when I do need them. Then I have another pack of scissors in here as well. So that is what I have in my stethoscope holder. And I'm gonna show you what else I have in here. So a lot of the times in the hospital, your patient will have their own blood pressure cuff, but I like to have mine just in case. It's the MDF blood pressure cuff, and usually they're plastic, and the patients will have them in their rooms if they're on manual blood pressures, but a lot of the times we're taking them by the machine, so I don't really get to utilize it much in the hospital, but I do have it just in case I need it. So just have that in there. It's pretty good. I haven't had any complaints. Okay, then the next thing I have in here, now sometimes I do take the classic stethoscope with me, and that's like the one I usually use, but I do have my other Littmann, it's a Littmann lightweight stethoscope, and I like it as well, so I just have it in there just in case something happens to my other one, and then I have a stethoscope with me. So I also keep a folder in my clinical bag. I keep like clinical things that I have in there. Sometimes if I need to know something that we're learning in school, I'll just keep it in here. It's just good to have your notes with you in case you have a question about something. So I just have that in here. I'm looking for my pins, but I usually have pins in here, and the pens. Clearly, I utilize them for a lot of things. Now, usually will have a pen and notebook in my clinical bag. So those are just really good and beneficial to have with you, just so you can. I like to always write down the vital signs of my patients so that I can remember them when I am charting, because when we chart in the hospital, you know, clearly don't have one of those movable computers that all of the medical professionals have, the nurses and everything, and the techs. So we have to go to the computers and put our things in. So I like to ensure that I remember what the vitals that I took. So just having a pen and paper that will easily go into your scrubs is really good. Just because if you don't want to have the clinical bag with you and just carrying all those things. So like what I would usually keep in my scrubs will be the pen in my little notebook, and then I'll keep the pen light, and I'll also keep the stethoscope. I don't really do it around my neck unless I usually do it like after I'm taking vitals or something like that, but usually I'll keep it in my scrub pocket. And another thing that is really important to have while you're in clinicals is a watch. So I have the Apple smartwatch. It's the 4th generation. And this is really good because when you're taking someone's heart rate and also someone's respiratory rates, it's really good to have a watch so that you can know how long you're taking those vitals for. So it's really important to have that. I just wanted to come on here and explain to you guys what I usually have in my clinical bag, and I also wanted to give a little bit of insight of my online clinicals. So right now I am in pediatrics and maternity clinicals. So I have those. I had pediatrics for 5 weeks, and now I'm in maternity for 5 weeks, and usually would be in the hospital doing these clinicals, but right now, like I said before, they are online, which is not a bad problem. I do get to see like simulations of patients, so you would take their vital signs and you would ask them questions about their past medical history and things of that nature, and it is really helpful to make sure that my history, like asking questions about the histories, intact and stuff. So I like that aspect of it, that I get to see which questions are right and which questions are wrong when interacting with my patients. But it would be better to, of course, be in front of a patient just to have that, person-to-person interaction. But like I said, COVID-19 did happen, so it's really hard to be in the hospital during those times, especially when the beginning of the pandemic had occurred and people, a lot of hospitals did not have enough PPE for their own workers and stuff. So they didn't want to have students there not utilizing PPE because they needed to have the PPE for their workers. So, and it's no problem, but I just wanted to come on here and explain that to you all. I was supposed to have 12-hour clinicals this semester, but hopefully when we're back in the hospital in the fall, I will also have a 12-hour clinical. So that would be really exciting, so I can get used to the 12-hour shifts that I would be having in the hospital when I graduate. Yes, so that is the video that I have for you guys today. If you guys could please like, comment, and subscribe to this channel, that would be amazing. If you have any questions that you want me to answer, whether it be lifestyle or nursing or anything that you guys want to come up with, please comment down below, because I would love to talk to you guys and to just get you know, just get acquainted with you all. And I really want you guys to give me some video tips, as in like which videos you might find interesting or intriguing to watch, because I do love to have ideas. I am new, so my videos aren't going to be the most, you know, amazing in terms of quality and everything, but once I start making more videos, I think that will be really, they will be really informative. And I think my next video I'm going to talk about how I study. So how I study in an online setting, because my classes are online right now, so we're not in the classroom. So how I study and like keeping track and time of my study times, because it is hard when you're you know, not in a classroom and you don't have to attend class as scheduled. I like to attend classes as scheduled, but I understand that life happens. So just please let me know what what kind of content I could give to you guys. Alrighty guys, I hope you enjoyed this video. Please, please, please let me know about things you're interested in and you want me to videotape. As always, I'll see you guys in the next video. Bye.